I'm here with Lisa Rezende from F.O.R.C.E, Facing Our Risk of Cancer Empowered, and we're here at ASCO 2016. Lisa, good to see you.
Thank you for having us.
So can you give us just a quick overview of the mission of F.O.R.C.E?
So F.O.R.C.E's mission is to improve the lives of individuals and families who are affected by hereditary breast, ovarian, and related cancers. And that originally was primarily people with strong family history or BRCA1 and BRCA2 mutations, but now as we're seeing expanded testing for other gene mutations that fall within those cancers, we are bringing those people into our community as well.
Great, and so as a medical writer and also as the Director of Education at F.O.R.C.E, how do you use the insights that you gained at ASCO and other conferences to really empower patients and previvors as well?
Coming to ASCO as a patient advocate is so important because not only are you hearing the talks that are going to end up in the news like hours later, but you're also getting a feel for what the buzz is around the oncology community as a whole. Mm-hmm. And as you come in different years, you can see as something changes and grows, and how the recommendations are really built. And that allows me to create educational materials that both tell patients what the current national guidelines are and to start preparing them with the base of knowledge that you're going to need as new and emerging information comes up to make the best decisions for their own health care.
And so in your opinion, what are some of the main takeaways from ASCO this year?
For the hereditary cancer community, actually interesting, the oral abstracts in cancer genetics are tomorrow, and I'm really looking forward to them. So I can't give you the highlights there, but from what I have looked at and talked to people about cancer genetics, we're now a few years into expanded panel testing for hereditary cancer syndromes. And it was really a change from where you just would test for BRCA1 or BRCA2 in a family with a high breast or ovarian cancer, to now the panels have multiple genes, and sometimes they're for syndromes that people didn't have before. So a couple of years ago, we were really getting the preliminary data from those testing and seeing how the family history correlates with what people testing there. Now things are getting more and more rigorous, and the more important of those genes where you're going to have and what the risk associated with each of them are starting to be understood. So there was an exciting education session this morning that was really starting to bring framework into understanding this. A lot of times, with a drug, everything's tested and it's come out. With the genetic testing, you're not necessarily have the condition yet, and so it can be very difficult for patients to understand what to do with this piece of genetic information in their hands and what that's going to mean for them, particularly when you have a family history of that disease.
Right.
And so making decisions when there's limited information to the patient, and then they look out and the physicians have to say, we have limited information because the research just isn't there yet, to come here and see how those guidelines are starting to be built and what types of discussions are happening and what new data is emerging that's going to help patients in the next few years and 10 years from now make the best decisions possible for their health based on this genetic information we have. I always say the BRCA mutation community, we're at the front lines with personalized medicine. We knew about our risk much earlier than some other disease states have, and so what we do and how we learn to interact with the research community, oncology community, can be a model as other people start learning about their risks for other diseases.